Welcome, everyone. I'm Steve Adubato. I want to introduce right out of the box two very important physician leaders who have an important message to share. Dr. Minaxi Jhawer is the chief of the Department of Hematology and Oncology at Englewood Health, and also her colleague, Dr. Rachelle Leong, who is a breast cancer surgical oncologist at Englewood Health. Good to see both of you.
It's a pleasure to be here.
Yeah, thank you for having me.
Let me talk about this. Breast cancer survivorship. Dr. Leong, what do we mean by that? A, and B, why is it so important for all of us to understand?
So breast cancer survivorship is kind of the end of their treatment. It's when they start to begin to resume their normal life with their family, kind of get back to their day-to-day, trying to get back to what they were pre-diagnosis as much as they could.
Dr. Jhawer, beyond breast cancer, cancer survivorship overall, is it different depending upon the cancer you're talking about, A, and B, are there just some similarities across the board?
Absolutely. So the word survivorship has evolved. It's from the time of diagnosis through treatment and beyond. And essentially, each diagnosis, even within breast cancer, everyone has unique types of breast cancers. So their survivorship journey or plan is very different and unique. Breast cancer is obviously the most common survivor cancer that you see in women, but prostate in men is actually the most common, and colon being second across the board. So each type of disease will have its own survivorship plan and journey.
What about caregivers? What about the role of caregivers for those who are survivors of cancer? Dr. Leong, what is the role of caregivers, and what should we understand about that?
So the caregivers is a unique role because I think a lot of times we think of the patient, but we have to remember that they are connected to a husband or a parent or a daughter or a child. And so they kind of go through the whole entire journey with the patient. And it's as important to support them as it is to support the patient, because they're going through the same stresses, if not more stress, because they feel a little bit helpless in the sense that they can't really make it better. And the family always wants to make it better for the patients. So it's important to kind of support them and give them whatever resources that they need to kind of travel through the same journey as the patient itself.
Dr. Jhawer, let me try something. It's impossible for anyone to be watching to say that there's no one. Let me put it this way: everyone watching right now has either directly been affected or a close family member, including myself. And I remember, I'm not going to say who it was because she has a right to her privacy, obviously. But I remember when she got the diagnosis, just the diagnosis itself is so devastating, so jarring on so many levels. The question of how to talk to someone who is facing cancer and then ultimately a survivor of cancer, is there, Dr. Jhawer, is there a way to talk that the rest of us need to be more sensitive to and aware of? Or am I making too much of this?
I guess what you're asking is in terms of family and the social support, or you're asking from
family
a
and friends. Family and friends.
So I think it's a really loaded question. And I think it's so important because, as you can see, everyone has a different perspective and way of dealing with news. The first thing is the shock, the denial of the information that's given to them. And then there's the rallying. And I think during that rally, people sometimes want all their close-knit friends and family to huddle around them and support them. And sometimes patients don't want to be asked too many questions. How are they doing? How are they feeling? They just want to cope and move forward.
But if we don't ask, I'm sorry for interrupting, but if we don't ask, and either one of you can jump in here to respond. If we don't ask, does that not send the message that we, as non-breast cancer or non-cancer survivors or people who are not facing that personally, that we don't want to talk about, that we don't potentially care or empathize that much? Dr. Leong, correct? I mean, that's the dilemma.
I think it really depends on the person. You know, a lot of my patients, I can see when they start to get used to coming to visit or to follow up, they start to come by themselves because I think in some sense they want some normalcy and they don't want to be reminded of the diagnosis all the time. So they start to try to regain a little bit of their normal life without the cancer diagnosis. So it's always great to follow up with everyone to make sure that they're dealing with everything okay, to make sure they don't need anything. But then after that, I think a lot of times it's just a matter of trying to give the patient or their loved one some space just to kind of regain whatever they can in their life and their day-to-day.
Dr. Jhawer, let me ask you, in terms of survivorship, beyond the communication aspect of it, and by the way, Englewood Health is one of the many healthcare organizations that support our healthcare programming. Just want to put that out there. There's a whole range of things beyond the communication, such things as, and whatever I'm not getting right, you'll tell me, or whatever needs to be added. Nutrition, mental health related issues, physical therapy, et cetera. And what else, Dr. Jhawer, what else is needed?
So there's almost two phases after they're done with the active treatment. There's an acute phase where you're still dealing with some of the side effects. And the most common at that point tend to be anxiety, residual pain or neuropathy, which is tingling numbness. And these symptoms tend to require a lot of support along the way, whether it's a referral to psychosocial, a psychiatrist to help cope, or to, in our case, integrative medicine. We really incorporate that in that survivorship model that we have, where an integrative physician who's a MD will actually sit down, talk to the patient, understand what their needs are, and then refer them to nutrition, Reiki, massage, acupuncture, some of those alternative pathways to help them regain their normalcy, improve their chances of reducing the risk of the cancer coming back with better diet, exercise. So all those things are then really personalized for that particular patient and their needs. But we do have all those services at Englewood.
Okay. And finally, Dr. Leong, I'm curious about this. We're on the back end of 2021 as we tape. The pandemic, COVID has impacted our lives in ways that are not even, you can't even calculate all of them. But in the world that both of you work in, to what extent, and it's a loaded question, I know, to ask, but it's important, is it fair to say that too many cancers are being diagnosed later than they should be diagnosed because of what's happening in the healthcare system, and that ultimately impacts survivorship? Is that correct?
Yeah, for sure. The pandemic definitely added a lot more later stage diagnosis. A lot of patients, including friends and family of myself, were very hesitant to go get their mammograms because of COVID, being in the hospitals, being exposed to other people. So a lot of people presented much later than they should have. A lot of people missed their annual screening. A lot of people missed their follow-ups with the doctors, which is just an important part of being a survivor. So a lot of the delay, we saw a lot of delay because of the COVID pandemic. And we still are. We're still trying to get out of this backlog.
Dr. Jhawer, Dr. Leong, I want to thank you so much for joining us. An important conversation, and I look forward to a follow-up. Thank you so much.
Thank you.
Thank you.
All the best. I'm Steve Adubato. Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the New Jersey Education Association, Choose New Jersey, Berkeley College, MD Advantage Insurance Company, the Fidelco Group, the North Ward Center, the Russell Berry Foundation, the Adler Aphasia Center, and by Community Food Bank of New Jersey. Promotional support provided by NorthJersey.com and Local IQ, part of the USA Today network, and by BestOfNJ.com.
Choosing a new family doctor can be confusing. Check with your health insurer to see which physicians near you participate with your plan. Find out which hospitals the doctor uses and who covers when the doctor is away. And remember to schedule an appointment with your new doctor in advance to fill out any paperwork without the added stress of being sick.